Rachel Cooper is a health writer and publisher of patient education on topics such as strabismus, neurorehabilitation, and vision therapy. Ms. Cooper is author and designer of the edutainment science book Magic Eye: How to See 3D, and the creator of the Optometrist Network. Rachel publishes many advertising-free patient education websites, such as strabismus.org, lazyeye.org, and visiontherapy.org.
As a child, I was diagnosed by both an optometrist and an ophthalmologist with untreatable lazy eye. But actually that was an inaccurate diagnosis. Number one, I didn't really have lazy eye, because lazy eye is the vernacular term for amblyopia, and I did not really have amblyopia. And then also it wasn't untreatable. Actually, I came to discover that I had a visual condition that's fairly common in children. It's called convergence insufficiency, and it can cause strabismus. Convergence insufficiency means the two eyes, when they're working together as a team, they typically converge or point inward and both aim at the same visual target at the same time. But a person with convergence insufficiency, the eyes are always drifting out, drifting out, drifting out. They're not working effectively as a team. So what this did is this often causes a type of strabismus called intermittent exotropia. And what does that mean? Intermittent means not always, occasionally. So my eye turn was not always there. It was, sometimes there. And it was exotropia. That means it was an outward turn. So what it meant was that I had one of my eyes would turn outward, and especially when I was stressed or tired or sick, or when I had to really use my eyes intensively for something, and especially, the stress of, like, let's use both eyes together to throw a ball or, or do something. I did not get any treatment as a child. Again, I was told that I had an untreatable condition. They said it was too late for surgery for me, which was actually really, I dodged the bullet on that, because surgery is a very bad choice for intermittent exotropia. Surgery is not a good treatment for quite a few types of strabismus. And what can happen is that the child will actually go through multiple surgeries because the turn keeps coming back. They did give me glasses, and those didn't work at all, and were very frustrating. So much to the consternation of my mother, I gave up wearing them. I didn't have any treatment until I was an adult. And as an adult, I moved to a part of the United States where I would actually meet other adults and other young adults who would tell me, I had lazy eye as a kid, or I had strabismus as a kid, and I did vision therapy, and I'm fine now. And the discussion was almost like, I had braces when I was a kid, and now my teeth are straight, and I was like, what? And so I investigated this vision therapy, which is a non-surgical treatment. It's like physical therapy for your visual system, and it's very successful in treating strabismus and other binocular vision problems. So as an adult, I did the vision therapy. I don't have a visible eye turn anymore, so basically the vision therapy did completely cure my strabismus as an adult.